Good afternoon, everyone. My iPhone says it's 5 o'clock, so I assume that's correct. So I want to welcome everyone to the Knox County Board of Health meeting for today, January 13th, 2021. After a call to order, the first order of business is going to be a roll call. And who is helping with our roll call today?
That will be Charity Murphy.
Okay. Sherry, if you could run us through the roll call, please.
Yes, sir. This is Charity Menifee with Knox County Health Department. Dr. Drake, or doing the roll call. Dr. Drake? I have not seen her come in yet. All right. Dr. Hurt?
Here.
Dr. Gocher?
Here.
Mayor Jacobs?
Here.
Dr. O'Brien?
Here.
Ms. Roma?
Here.
Dr. Shamia?
Here.
Dr. Souza?
Here.
Ms. Wagner?
Present.
And Dr. Buchanan?
Here.
All right. So we have 9 present and 1 absent.
So Dr. Drake hopefully will join us here shortly, but we do have a quorum established. So the next order of business is our public forum. And who at the health department is helping us administer that? Charity, are you helping with that today?
Yes, sir. That's me again.
Okay.
So you need to look.
Okay, so we are ready. First up, we have Mr. Robert Weed. Mr. Weed, if you'll please state your name and address, and you have 3 minutes.
And who at the health department is helping us administer that? Charity, are you helping with that today?
Yes, sir. That's me again.
Okay.
We're getting some feedback. If somebody that's on the call has YouTube streaming, we think that might be the problem. Mr. Robert Weed. Mr. Weed, stand by.
Okay.
This says we're live on YouTube. Is that us?
We are. We're supposed to be there.
I know, but are we the ones on YouTube?
No,
Getting the feedback.
I don't think so. We're going to try this one more time. Let's see if we get some feedback with me talking. This is Charity.
Okay. Sounds like we might have addressed the problem. So, Mr. Weed, you have 3 minutes, sir.
Thank you. I want to first thank the Board of Health for allowing me the time to voice my opinion and share some of my concerns with the 10 o'clock restaurant curfew. As the owner of Just One More Bar and Grill and resident of Knox County, I'm afraid and concerned for my employees, patrons, and community. I've seen how these now enforced curfews have put people in the high-risk settings and have denied others their freedoms. Please take a moment to think of how these curfews have denied civil liberties to parts of our community. Put yourself in the shoes of our first responders, second or third shift workers, or someone in the service industry. These residents work just as hard as those that work 9 to 5. They are told that after serving the community, they are not allowed the same privileges as others. They're not allowed to have a meal at the restaurant they used to frequent or to have an adult beverage at their favorite bar. And most importantly, a place to mentally unwind after a hard day. That their freedoms are not granted because of the time they get out of work. The curfews have also hampered small businesses that serve the residents in our community. It has forced us to lose revenue, cut shifts in half, and lose employees. We have proven that we can serve the public before 10 p.m., and we should be given the trust to do so after 10 p.m. as well. Not all establishments are the same, nor is the clientele the same they serve. This curfew is one size fits all, and we're not all the same size. I know the intention of the Board of Health is to protect our community, but as we've seen, the residents of Knox County still want to go out after 10 p.m. So how do we solve this problem? I believe it begins with trust in our small businesses. I myself have been serving the public for over 35 years, with the last 25 years in the bar industry. I can tell you that we are held to a higher standard than most businesses. We are inspected by the Health Department, Tennessee Alcohol Beverage Commission, and our fellow residents. I have ensured the safety of my patrons well before COVID-19 was ever in our lives. I continue to provide a safe environment for my patrons during this pandemic. I have put safety measures in place and can account for their effectiveness. I think most business owners would be happy to share what has worked for them and not worked for them. It is time to listen to those affected most and find new ways to prevent the spread. I hope that I have provided a different but important view that you may all not have accounted for. I can assure you that none of us want to spread COVID-19. We don't want it in our businesses, especially not our employees or patrons. And we want to keep our community safe. It is time for us to trust in our business by allowing the public to spread out over many venues and have safety measures in place, ensuring a more protective environment than what the curfews are causing now. By granting our residents your trust, I believe that they will be willing to comply to new safety protocols if they arrive. It is time to have faith in our neighbors and allow them the freedoms and liberties they so deserve. Thank you for your time. And let me say that how much I appreciate your efforts in addressing the task before you. I hope that voices like mine can continue to be heard and provide solutions to solve the problem. Thank you for your time.
Thank you, Mr. Weed.
All right, next up, we have Mr. Kevin Hill. Mr. Hill, if you could please state your name and address, and you have 3 minutes.
Kevin Hill, 509 Cambridge Street, Knoxville, Tennessee, 37920. I want to thank you for the chance to again speak with you all. I'm not here for us to have a conversation about what we are divided on today. We all know we have differences of opinion in our community. I've been one that has voiced that to this body. I'm here today to ask you all to consider in your new business section, offering a resolution condemning the death threats to the county commission. It is an anathema and disgusting to me as a resident, no matter how much I disagree with an official or an entity in this county, to engage in childish and foolish and reckless behavior. Because while those who have issued such threats, and be clear, I'm not in any way implying responsibility to this board, but they are doing it in an attempt to foolishly show solidarity or support for this board. And so it's necessary for this board to come out in a very strong and very powerful way, show complete and utter displeasure and distaste for that kind of behavior. Our commissioners quite literally have had credible threats that have required deputies to watch and guard them. And I'm sure that that is as much an anathema to each of you, regardless of our differences of opinions, as it is to me. So that's my request. And that's the only reason why I'm here. I do not want to create any kind of distraction from that, which is the singularly most important thing I could ask of this board today. So please consider in your other or your final session and other business to initiate a resolution condemning in a very powerful way anyone who would try to attempt to co-opt your credibility by engaging in such foolish and reckless behavior. Thank you.
Thank you, Mr. Hill. I believe that concludes our public forum speakers. As requested previously, we're allowing 15 minutes for Board of Health to respond to the public forum speakers.
So any comments from the board on either of our two public forum guests this evening?
I'll start off. I want to thank Mr. Hill for what he brought up, and I think it's something that should be just understood. We condemn all threats against the Knox County Commission. It didn't really make the news, but we've had threats, and we all, I think, in service to the public right now are having some difficulties. So, you know, we condemn threats against them. We condemn the threats against us that we've had to report to law enforcement and to ask for additional protection. That has not been something that's been vocalized, but we stand ready to do what we can as the Board of Health to look for better health for all of us. And you know, trying to threaten us or threaten the Knox County Commission is just not the way to go. We're all in this together. We are walking with the Knox County Commission, trying to do the best for our community. So I do commend Mr. Hill for bringing that forward, and just want to state that up front.
Other comments from board members?
This is Maria Hurt. I would like to thank both our speakers for trying to address what we have in common rather than our differences. And I agree with Dr. O'Brien, the threat of violence threatening anyone's life, any public official, any non-public official, any ordinary citizen is wrong. It's illegal. It is a legal issue. I don't know what our, this is a question for Mr. Sanders, what our abilities are to pass a resolution asking for specifically, threats of violence directly to the county commission. I would say broader than just any public official, but of course, yes, anyone making those kinds of threats, certainly in defense of us, is irresponsible, not based in reality, harmful. And, I denounce any kind of verbal, physical threat or violence whatsoever to any public official or any fellow citizen. What we can do as the board legally, I am unclear. Again, as I said, that'd be something for Mr. Sanders. That's all I want to say. Thank you.
Any other comments from board members? If not, I'll just have a short comment that I will affirm what Dr. O'Brien and Dr. Hurd have stated, that we are, just as a matter of course, against physical violence as a means to settle any issue. And we've certainly seen in websites and seen instances where our board has been threatened with physical violence to us and our families, as a matter of fact. And I'm assuming that something similar has probably been sent or communicated to the Knox County board as well, or not the county commission. And there's no place for this. It's to be soundly condemned. And within our power as a recommendation, I would be strongly in favor of a resolution stating that this has happened and stating that we condemn it.
I would support that. And can we ask Mr. Sanders at this time to clarify what we can do today?
Sure. You can, in fact, pass such a resolution. You can either try to write one up and present it, if somebody has the talent to do that while carrying on the rest of the business, or you can come up with the best language you can, propose it verbally, pass it, and then someone can transcribe it later and get it signed. I'd probably recommend the latter tactic. I don't quite see how you're going to manage to write and meet at the same time. As far as what we do with any such threats, those of you who've communicated them to us, we refer them to law enforcement as far as the actual threat is concerned. Obviously, this board has no power to take on the person making a threat or carry out any law enforcement actions itself. But you can certainly pass a resolution, and if you wish to, I'll certainly assist you with that.
Thank you, Mr. Sanders. Any other points of discussion on either of our two public forum speakers by board members?
Dr. Gocher, could I just bring up something here, since it's public forum, or just to bring information? Figure bring it at the beginning of the meeting so more people might hear it. I want to thank members of the county commission who have spoken to me. A majority of commissioners during the last couple of weeks have spoken to me, and I want to thank them for that, for having honest conversations and looking for the things we have in common versus where we're trying to butt heads. The time for butting heads is behind us. Again, I think that we're starting to be on the right track. We're looking to try to move in the right direction. I'm hopeful that that Commissioner Ward will not go forward with his ordinance that he has proposed, and let us continue to work together going forward through this pandemic. If for some reason that does come up and passes, well then, per the TCA, then our board would effectively be dissolved, and it would be up to the Commissioner of Health or Dr. Buchanan, somewhere on that side, to come up with an advisory board at that point. And I'd wait and see what happens. But I think right now, the main thing is that we are working toward some commonality, and I want to keep those lines of communication open and realize that we are here for all our citizens, both organizations, and applaud that conversation. Thanks.
Thanks, everyone. If there are no further comments, we can go on to the next item. Any further comments on our public forum? Again, as a board, we certainly appreciate their input, and appreciate their stepping up and giving us valuable information, both of our speakers.
Dr. Gutcher,
Yes.
it appears Dr. Drake has joined us, so I can see her. Dr. Drake, would you mind doing a audio check for us, please?
Diana Drake. I don't see my picture though.
We see it.
Y'all see it? Oh, okay. Thank you.
Thank you, Dr. Gutcher.
Welcome, Diana.
Thank you.
So if there are no further comments from Board of Health members on the public forum, we can go to the next item of the agenda, which is approval of the minutes of the meeting from December 30, 2020. You should have had those, you should be in receipt of those. So if you've had an opportunity to look over those, at first, just quickly ask if there are any additions, corrections, changes in the minutes. I saw one just spelling change, and it's in item Roman numeral 5.1, where it said 129 new confirmed cases. SINE, it's supposed to be since, so it's just typo there. Everything else to me looked in order. Any additions, corrections, any difficulties that anyone sees with the minutes of the meeting? If there are none, I'll accept a motion and a second for approval of the minutes from December 30.
I'll move to approve with that correction.
Second.
So we have a motion and a second. Any further discussion on the minutes of the meeting from December 30th? If not, Charity, if you will assist us in a roll call of that motion and second.
Yes, sir. Dr. Drake,
Yes.
Dr. Hurt,
Yes.
Dr. Gocher,
Yes.
Mayor Jacobs,
Yes.
Dr. O'Brien,
Yes.
Ms. Roma,
Yes.
Dr. Shamia,
Yes.
Dr. Souza,
Yes.
Wagner,
Yes.
Dr. Buchanan.
Yes.
Passes unanimously.
Thank you. We have approved the minutes of December 30. The next item on the agenda is to set the agenda. And again, you should have the agenda before you, or it has been transmitted to you. Are there any additions, corrections, deletions, any issues with the agenda as we have it set?
I move we accept the agenda.
We have a motion. Do we have a second?
Second.
We have a motion and a second. Any further discussion on the agenda?
I guess just quickly, did we want to add something on there about anti-violence resolution of sorts? Or anti-threats, I guess, whatever you want to call it.
Dr. Seuss, I think that can be done in other business, but
Okay.
Mr. Sanders, is that something we need to specifically add, or is other business work for that?
I think that other business works fine for it, but you can certainly add it if you wish.
That's fine.
Okay. Any other discussion on the agenda? We have a motion and a second before us. Any other discussion? If not, Ms. Menifee, if you'll run through the roll call for the approval of the agenda, setting the agenda, please.
All right, this is Charity Menifee with Knox County Health Department, setting the agenda. Dr. Drake. We didn't hear that.
Yes. Yes.
Thank
Got
you.
it.
Dr. Hurt,
Yes.
Dr. Gocher,
Yes.
Mayor Jacobs.
Yes.
Thank you. Dr. O'Brien,
Yes.
Ms. Roma,
Yes.
Dr. Shamia,
Yes.
Dr. Souza,
Yes.
Ms. Wagner,
Yes.
Dr. Buchanan.
Yes.
Passes unanimously.
pardon me. We have set the agenda. The next item on the agenda is Knox County Health Department's benchmark presentation by Dr. Buchanan. So Dr. Buchanan, if you are ready, we're ready to listen.
I am ready, thank you. So first we're gonna pull up, since we're now in vaccination land, we're gonna pull up our vaccination page. So make this part of our update each meeting. So Knox County Health Department continues to vaccinate those who fall within the first priority group phases, including healthcare workers, first responders, those 75 and older, among other groups. Full list can be found on our website. To date, we have received 4,700 doses of vaccine and administered more than 4,000 of those doses. The rest of those doses are scheduled to be administered this week. As a reminder, this only includes what the Knox County Health Department has received and administered. It does not include thousands of doses that have been administered by our hospitals, corporate pharmacies, as part of their federal partnership with long-term care. So our local hospitals are vaccinating thousands of people as well. Outside their employees, they're helping to vaccinate the community. And right now, if you look at the state website, Knox County has over 3% of our population vaccinated, which is not at the bottom of where the state is, but not at the top either. So we feel good about that. We're moving forward with getting our citizens vaccinated. Now we'll move on to any questions about vaccine before we move on?
Can I ask one quick question about the change that was noted this morning on the federal government for age 65 and up? Is that something that will be implemented within the next couple of weeks here?
We'll have to wait for guidance from the Tennessee Department of Health on that. They set the priorities for the state. I have not heard any updates from the state regarding that at this time.
Dr. B, this is Mayor Jacobs. Could you just please remind everyone who's watching that just like with testing, where it started out as primarily the health department doing a lot of it, the same with vaccines, the health department and certainly the hospitals are doing the majority, but we don't have the staff or we can't scale up to eventually this is going to be an effort by a lot of private providers. At its peak, we're supposed to be receiving about 90,000 doses of vaccine a week across the state of Tennessee, which of course, when you spread it out across 6.5 million people is not as much as it might sound. But nevertheless, eventually it's not going to be the health department that people are going to. It's going to be private providers. Would you just mind reinforcing that, please?
Sure, no problem. Yeah, so as the mayor said, the hospitals and the health departments are the primary vaccinators right now outside assisted livings and long-term care. And as more vaccine becomes available and we receive more vaccine into the community, that vaccine will eventually move into the places where people expect to get their vaccine, like at their doctor's offices or at the pharmacies that vaccinate. I think the pharmacies might be the first place to get vaccine and open that access up to folks in the general public. Those groups will also be asked to focus on the priority groups throughout the vaccination phases. We can expect that vaccine demand will outpace vaccine availability for some time to go. We have over 30,000 75 and older residents in Knox County, and just beginning to vaccinate those folks. So that's a large population. If we move up to the 65 and older,
I'll have to double check it, but I believe it was over 75,000.
Yeah, so that really jumps that number way up. So the hospitals and the health department are getting vaccine out as quickly as we get it, so that it's in people's arms and not sitting in our refrigerators or freezers. So now, any other questions about vaccine?
I'm going to make one more comment too. I'm sorry to keep on interjecting here. But I think also folks in the region need to understand that because Knox County is a media hub, I think that, often people look at Knox County and say, well, you're doing things differently than the other counties. There's vaccine available in another county, but not in Knox County. And part of the reason, I think, is there's just been so overwhelming demand here. Everybody has done a wonderful job, the health department as well as the hospitals. But I would remind everybody again, Knox County is different. We're one of 6 counties in the state of Tennessee that is not directly under the State Department of Health. So our systems are going to be different than the states are. And also the demand is somewhat different, and the uptake here has been much higher than it has been in other counties. Again, our people here are doing a great job. It's just a different dynamic that an urban county faces compared to some of the smaller rural counties.
Okay, any other questions about vaccine? Thank you, Mayor Jacobs.
Dr. Buchanan, I have one question. There's been certainly information in the news nationally that there's a push to release all available vaccines as soon as possible and not have a reserve for the second vaccines for Pfizer and Moderna. Have you had any information along that line, or do you know whether that's going to happen, or what, how that's going to affect our shipments, or how we go down the priority list?
So again, that guidance comes from the federal government down to the state and then down to us. So in my most recent conversations with the state asking about that, some of that depends on what the current and incoming administrations decide to do in relationship to vaccine and how they decide to get vaccine out into the communities and across the nation. I think we'll have to wait and see. I do think that one of the challenges, if they do release the vaccine that's available and not hold those second doses back, second doses are important, and we certainly want people to be able to get those. So we want to know for sure that the manufacturers are able to produce enough vaccine so that people can get their second doses reliably to ensure better protection. These vaccines are effective even with the first dose, about 70%, which is very good for vaccine, much better than flu shots. So it's an effective vaccine. So again, we kind of have to wait to see what the federal government does and then what the state does in relationship to what the federal government decides. And I know that's frustrating. It's frustrating for us not knowing how much vaccine we're going to get and when we're going to get it necessarily. But just to kind of clarify some of that, right now, the state is told by the federal government what the statewide allotment will be every week. So it's not like for January you're going to have this many doses. It's each week they tell the state what the allotment will be, and then the state looks across the state and allots that out to the 95 counties, and trying to be equitable and also focusing on some of those socially vulnerable counties, which are smaller, poorer counties, to get the folks vaccinated there, because their case rates and death rates have been quite significant compared to some other places. So it's a big effort, it's a big challenge, and it's just a big machine that's going to take a while to get all the vaccine out there and get it delivered.
Just to update, this is Charity Menifee with the Health Department. I did look, according to the most recent census estimates, persons over 65 years of age represent 16.2% of the population. And when you do work out the math on that, that is about 70,000 people. So that's a dramatic shift if that happens in priority groups.
That was what was announced by Secretary Azar this morning, that they were going to go ahead and authorize it now instead of waiting for the new administration. So it'll take time, though, for it to happen, I think. So we all need to be patient, but it's coming.
And I'd like to just reemphasize a point that's already been made, just so that the more we can educate the community on this point, is regardless of what the federal government may say about 65 and over, we're following what the state tells us. And so they can say that on the news, and certainly that creates a lot of questions and phone calls, but ultimately look to what the state and the governor say. That's what we're following.
Any other questions about vaccine? Okay, then we'll move on to our situational update. Oh, I actually forgot one thing, and while we're pulling up the numbers, we are building with county IT support an online registration system, which we hope to have available this week for people to be able to register online to get a vaccine. We anticipate, like all other systems, that will fill up quickly, but we want to allow a way for folks to get appointments to receive their vaccines. So hopefully that'll be coming soon. So we have 164 new confirmed cases since yesterday's report, 4,936 active cases currently. 167 Knox County residents are currently hospitalized, and sadly, 4 additional deaths to report today, bringing our total to 383. So for our first benchmark, sustained reduction or stability in new cases, for 14 days. Over the past 14 days, we saw daily new cases climb back up over 300 per day, which is up from the previous reporting period. Because of this, we are representing this benchmark as red. It's important to note that we have seen a decrease over the past couple of days this week regarding daily case updates or case counts. While this is encouraging and we hope a trend continues in that direction, we'll just have to wait and see if that continues, because it's not a trend until it's and we've seen it go up and down. If you look at the daily cases, it definitely goes up and down quite a bit. For our second benchmark, community-wide sustained and increased diagnostic testing with consistent or decreased test result, reporting turnaround time. Regarding testing, over this time period, we continue to see this figure remain consistent with more than 10,000 tests conducted per week in Knox County. Lab turnaround time remains stable at 3.5 days per average. Because of these factors, we are representing this benchmark as yellow. Third benchmark, sustained or increased public health capability. Based on our internal assessment of our capabilities and acknowledging the continued need to prioritize our case investigations and eliminate our contact tracing in order to support additional resource operations, we are representing this benchmark as red. And I'll entertain questions about the changes later. Fourth benchmark, healthcare system capabilities remain within current and forecasted surge capacity. During this time period, there were flags detected for all categories. However, this past week, we have seen a slight downward trend, which is encouraging and something we hope to see continue. After speaking with our hospital partners, they have recommended that this benchmark continue to be represented as red. And as usual, Dr. Shamil will say more about the hospital situation. Fifth benchmark, sustained or decreased COVID-19 related death rate for identified positive or probable cases. During this time period, we've seen 58 deaths associated with COVID-19, which is an average of about 4 deaths per day. This is just slightly down from where we reported last week. The information available leads us to continue to represent this benchmark as red. In our supplemental data section, the first chart shows our daily COVID cases per 100,000 population. As of Wednesday, our 14-day trend line shows 64 new cases per 100,000, and our 7-day trend line showed 68 new cases per 100,000, which is slightly up from last week. The second chart shows the percent positive for COVID-19. The data is received from the Tennessee Department of Health, or this data. The 7-day average for percent positive in Knox County is 22.4, which is kind of stable, I think, for the last few weeks. So not trending up or down. Not good, but kind of stable. Stable in a bad way. So any questions about the data or about the changes that we've made regarding contact investigations?
I have a question that might be slightly off topic, but also might be in line with everything. We had and it might also be a question for Dr. Shamia. I'm not really sure. We had a really specific question in our email about the difference in reporting between Knox County and the state of Tennessee. I can read the email if needed, but really, is it just, sometimes there's just a lag in the data update and the reporting. You all have talked about the differences in numbers and how they don't often match, or how sometimes they don't match up. And I'm wondering if you could help out with that at all. And I can read the email if needed.
But
Yeah.
I think we were familiar with the question, and Charity will be able to answer that question better as she works with the data more often than I do.
Hi. So the simple answer is typically timing of when the data is pulled. And so that's the most, for the vast majority of differences, that's what it is. There are sometimes some differences and we've talked about this previously, but it is always good to remind folks of cases that are living or staying in Knox County that have a different county or a different address that we count in our numbers, but sometimes that doesn't translate into the state's count. That happened a lot with students early on in the fall, but it does still happen occasionally here and there. But the vast majority for case counts typically are just timing of the data. The other piece, I think if it's the same questions I believe we received that I addressed with some other folks already this week, was about the deaths. And so the differences there typically are we report the deaths on the day that we get them, and we are getting death notifications from hospitals, from providers, and from local medical examiners, sometimes the state medical examiner's office. And so we report those out as we receive them from those providers. And then the state goes back and the state medical examiner's office reviews every single death and does a full review of those. And so I would suspect, and I haven't been able to get confirmation yet, but the difference in those numbers right now is a delay given the volume of the increased volume of deaths that we are seeing across the state, just being able to get through all of those reviews. But that's typically the differences.
Thanks, Charity. And you do address that often in the health department media briefings, right? Okay, thank you.
Any other questions?
Yeah, Dr. Buchanan, would you mind just giving an overview of the changes in the contact tracing, please, for everyone?
Sure. So in an effort to shift resources and prioritize vaccination as we receive vaccine and need to be able to mobilize to do that. And also because contact tracing at this level of community transmission has become less and less useful. Early on, when you have fewer cases in contact tracing, you can really use contact tracing to reduce risk and reduce transmission. But at this point, we all need to assume that everybody we know and everybody we're around could be a case. So contact tracing is less useful, and also just the increased need to focus on vaccination. We are no longer contact tracing, and we're actually only contacting cases that we know of within 6 days of their diagnosis. And so that is in line with the State Department of Health. They're doing that as well, and have decreased their contact tracing efforts as well, because they're all having to shift focus to vaccine. With the as with testing early on when things are rolling out, public health has a major role in that. But as we talked about earlier, that will shift eventually to the public sector more than it is in the shift to the private sector more than the public sector. But right now we really need, if we're going to get the vaccine out almost as quickly as we get it in, we've really got to have more people to help us do that. And so that's why we've shifted those priorities. We are calling cases and letting them know what they need to do, giving them resources and telling them to notify their close contacts and giving them the tools to calculate the quarantine and isolation, and trusting that folks will continue to isolate and quarantine as needed.
Dr. Buchanan, can we add on that about not providing letters?
Oh, sure. In addition to that, we were in the past providing letters for employers or schools or whomever is asking for a letter for release from quarantine or release from isolation. We are no longer providing those because a lot of cases we don't contact. And so employers and educators and others will need to rely on other ways they get documentation from their employees, such as test results or something from a physician or something like that. So, and also just trusting their employees that they do really truly need to quarantine or isolate. So falling back on what you normally would do when somebody is sick and needs to be home and needs to have a release to come back to work. They get it from their doctor, or maybe from, if they want evidence of disease, they can get their lab results for that as well.
We do provide a letter on the front end for the cases we interview, but it's not a separate release letter anymore. And there's no contact letters available since we're not gathering those.
So, Dr. Buchanan, with schools back, does this change your level of engagement with them as far as, and are they still doing kind of that classroom contact tracing? Because we'd heard so much about it's not really transmitted in the classroom, but they were also being pretty aggressive, making sure that folks were, you know, being quarantined if they've been exposed, et cetera. And so has that changed?
Well, I'll let Lisa talk about what the schools are going to continue to do. So the change in what we're doing is that, so schools were a combination of community exposures and school exposures. So we are no longer investigating the community exposures. So, and honestly, the schools frequently knew about cases before we did, because a parent or student would tell their teacher or the school that they had COVID or that they had to quarantine. So, and internally, the schools will continue to do their investigations and do things to reduce risk within the school. And Lisa can speak to that better than I.
Hey, Dr. Shamia, yes, we still do contact tracing within the schools.
And we're also asking businesses to work with their employees to reduce risk within their business. And, you know, when we educate the cases and have them inform their employer and their coworkers about risk and what to do about quarantine.
And we also provide letters on the front end instead of at the end to all parents.
Okay, thank you.
Sure. Anything else?
Any other comments or questions on Dr. Buchanan's report? If not, Dr. Buchanan, thank you very much again for that elucidating report. And if there are no further comments, we'll go on to the next item of the agenda, which is UT Medical Center's Knoxville data update. Dr. Shamia, thank you.
Thank you. So the overall message is going to be very similar to what Dr. Buchanan went through. So next slide, please. So this shows that you see 3 weeks ago how many cases we had in the county and how much it dropped off. And certainly we thought that that first drop off was likely related to that related to the lack of testing or decreased testing around the holidays. But now that it's dropped more, it does seem like, and guys, the reason I paused is that I don't think this is the most recent presentation. There's 1 week missing on this one. I think this is the one that was sent the week that we were off. I can potentially, could very easily share a screen if that would be helpful, unless you guys have it handy.
We can find it, or if you have it handy and you want to share your screen.
Might have grabbed the wrong one. Yeah.
That's fine too.
Okay, well, we can race. How's that?
Okay.
Oh,
Here's Catherine.
Okay, you're faster than me. Okay, sorry for that pause. You guys probably wondered what was going on there with me. So, okay, so the message is the same, except that, so we initially had that decrease after that big spike, and that was really felt to be decreased testing around the holidays, but it has sustained to some extent. And so you see that we've kind of leveled off there at around 2,700 cases per week. I think one point there, and one word I'll probably use several times in the coming weeks, is normalization bias, or 2 words. Normalization bias is that, you know, we say 2,600 cases a week. I mean, that's a lot of cases, but it's also not 3,900. So we just have to be careful that we don't get so numb to some of these numbers that we feel like that they're just okay. But there may be something, our sense is there may be something real there in terms of some decrease in diagnosed cases. And you see the same thing in the district that you see in the county. Next slide, please. So across the community, you actually see Shelby maybe legitimately dropping a little bit, but for the others, these last few weeks has been that same kind of leveling off phenomenon. Next slide, please. So when you go across the ages, what you see here is that there may be even, there's a leveling or even an increase in 21 to 30, 31 to 40, but in that 51 to 60 and then above, there seems to be a little more of a decrease there. And so if that's real, that would suggest that some of those who are potentially more vulnerable or more likely to be hospitalized are not being diagnosed at the same rate. And that is, when we look at the hospital census, that may be a cause effect type thing. So that is potentially a positive sign. Next slide, please. So this is, the positivity rate, now that maybe our testing is ramped back up, has dropped just a little bit. So we were in that kind of unheard of greater than 30%, now going back toward 25%. Remember that we've said we want to be below 10, and quite frankly, would want to be below 5 on this, but anything that is starting to trend in the right direction, we will take. But the thing that gives us pause on the hospital side is that when you're at 25% positivity, it would just suggest that you really don't know what's going on week to week in the community. It's when you're, when you're testing so much that you can get this down, you have a real good handle on it. So the ability to predict what next week's going to look like or what the week after that's going to look like is less when you're at this high level of positivity. Next slide, please. So this gets back to the discussion we had a few minutes ago. We even put a specific box by that most recent amount of hospitalizations in the last week. We do think that's because of some delay in reporting. I mean, that is a big spike of new hospitalizations, and that doesn't really necessarily correlate with what we're seeing on the census side. So I think we just need to see if that settles down now that we get out of the holidays. But you just take it for what it is. Next slide, please. So for the hospital census, the reporting around the holidays was spotty, but we can say that where we actually have numbers there, we feel pretty confident that those numbers are very reliable census days, but it's jagged probably because of more reporting issues than that it was that jagged. But what you do see is that we have seen a decline here in these last several days in the community, as Dr. Buchanan said. Whether or not that correlates with maybe some decrease in newly diagnosed cases in those 51 and older, we're not sure. There certainly are a variety of theories, which I won't necessarily go through here about, why is this going down, or what, cases, hospitalizations. But regardless, I agree with what Dr. Buchanan said. A few days does not make a reliable trend, but we would love to see this persist, or is it going to just level off somewhere, or is it going to spike back up when we still see what I think is I don't think we're through the potential for a post-holiday spike at this point. Next slide, please. I think the final slide. And so you can imagine, though, with the downturn of that, it sends these projections all over the place. And so you see the green and red trend lines for 30 days out, and then the most recent trend line after the dip in the last week, how much lower that is. And so, it's only when we see 3 or 4 trend lines in the same direction that we feel more confident about the 30 days. So let's see if next week's line looks like this week's line before we get too excited about that. But at least there is some positive trending in the last 7 to 10 days, and we'll take that. So I believe, Dr. Gocher, that's the end of my prepared comments, and I'd be happy to take any questions.
Thank you, Dr. Shamiya. Any questions or comments from the board on Dr. Shamiya's report this evening?
Dr. Shamiya, I do have one question. It's not about your data, but when we look at the White House report, one of the things they talk about is having monoclonal antibody infusion available in the community as an important treatment for higher risk individuals. And Can you comment on that availability of monoclonal antibody in Knox County?
Yeah, I'd be happy to. So just to kind of make sure everybody's aware of that first. So the monoclonal antibody, there's two different products under emergency use authorization. It's strictly for outpatients. And so once you're sick enough to be in the hospital, it's actually, there's concern it could make patients worse. But the idea is that there are, in the emergency use authorization, specific populations of patients that it's been approved for. And those are the groups, either based on age or other risk factors, are most likely to progress and end up in the hospital. And if you infuse it within several days of symptoms, then the idea behind it is there was data to suggest that those patients were less likely to be in the hospital and end up hospitalized than they were before. And so we've had access to that for, I can't really precisely remember how long. It's been several weeks now, a few months maybe. And there's a lot of challenges to doing an outpatient infusion in a patient who is infectious with COVID. So you can't just do it in your regular outpatient infusion center. So the health systems have all stood up slightly different approaches, but very kind of similar end result is ways to identify those patients from a referral process. And then once they meet criteria and agree, it's about an hour infusion, and then they have to be monitored. But there is a limitation to how much of that can be done every week, because there's only so many of those patients that can be infused per day, because again, it's a complex process to go through, like so many of these things have been. But there's quite a few infusions per week across the community, and that could actually be having a favorable impact on those hospitalization numbers. When you think about, there's a certain percentage of people, and you never know who they are, but a certain percentage of people who got it who might have ended up in the hospital otherwise. Is that, Dr. Buchanan, does that answer the question?
Yeah, I just wanted people to be aware of that there's a lot going on related to treatment and prevention. And one of the recommendations is that information on monoclonal antibody infusion is available at the time of testing. So that's, something we could talk about with our hospital partners and us. And right, but I mean, getting the information on, who qualifies and who's appropriate, so that people can be given the information.
And I think what some of us have done is, in the areas where we have the control of that testing, in an emergency department setting for whatever, we do try to have that conversation, not even known if they're positive or negative, but clearly there's testing going on elsewhere in the community as well. But there is there's a ceiling to how much of that can be done, but it's been ramped up very nicely. It's been another situation where the systems have collaborated and come together and done something in a consistent manner.
Thank you.
Any other comments or questions? Dr. Shami, I have a brief question. Any information about numbers, ability to withstand surge, and outcomes on our intensive care unit patients in the area?
A few things. I will say that last week we had a particular eye on the ICUs, and there sometimes is a disconnect, meaning the entire census is going down a bit, but everybody feels more of the strain in the ICU. But this week is seemingly somewhat better, and at no point in time were we close to that critical point of saying, oh my goodness, we're not going to have the ICU beds or the ability to take care of these patients. From an outcomes perspective, I will say that, for at least in our data, and I think Dr. Buchanan, this fits with the community, we saw about mid-December a definite rise in the overall mortalities. There's no question about that. And so the outcome, when a lot of those patients at some point in time in their stay were in an ICU. We still have plenty of success stories that come out of the ICU, sometimes prolonged recoveries. But that's the other thing that, quite frankly, may be impacting management of the census a little bit, is we did see, starting in mid-December, a definite increase in those hospital mortalities.
Thank you. Any other comments or questions for Dr. Shamiya? If not, thanks again for your timely report. We always appreciate it. Next item in the agenda is questions for educational institutions, and we have presentations that we should have received, one from the University of Tennessee and one from Knox County Schools. Any comments from the board on either one of those reports? Or Ms. Wagner, if you have any additional information on the Knox County school reports.
I don't have anything to add to those reports.
Any
Yeah,
other
Questions?
The truth is, everybody's just kind of getting back in the swing. And we'll
I don't know if
probably
you noticed, but we have 2 schools that are closed that are red. And that was, sorry, the teacher and student, the metrics, we met those metrics for it to turn red. So that's Moreland Heights and Sturkey Elementary, but they'll be opening back up on next Tuesday.
Ms. Wagner, any changes to or anything, what's in place for extracurricular activities to reduce risk?
Well, it's not the same. We still have extracurricular activities. We're still going to have those, but everybody have to be socially distanced. And I think the number of people that can come is limited to, parents or one family member or something like that. But everybody will be socially distanced. And we're following the TSAA guidance for, sorry about that, for extracurricular activities.
Thank you.
Any other comments from board members on our 2 supplemental reports? If not, as always, we appreciate the input from Knox County Schools, and we appreciate the input from the University of Tennessee. Next up on the agenda, item 11 is review and discussion of our regulations. We have 3 we're going to discuss this evening, and the first is 2020-1, which is the face covering regulation. And as you know, that's been in force since July 1 of last year, and it has no specific expiration date. So any comments, questions, concerns about 2020-1? Dr. Buchanan, any reports to the Board of Health about positives, negatives, issues, anything like that that you hear?
I think we get the random complaints about it not being enforced, or it's pretty random. It's not consistent. It's people just have complaints periodically about places enforcing or not enforcing the mask mandate. And so there's no consistent theme to it. We reach out and educate those places of business as needed and work with them. I continue certainly to see consistent mask use in the places that I go, although my travels are much reduced compared to pre-COVID. But the places that I go, I certainly am seeing consistent mask use. And among my friends, seeing consistent mask use. So I think everybody's kind of come to terms with mask use.
I think you're right. Any other comments or points to discuss from our board this evening on 2020-1?
I'll just bring up one thing that was brought up to me this past week, which is about some pictures being posted on social media by some young adults in gatherings with no mask in parts of Knoxville. We just want to encourage you all at that age group, please, just because you're in your 20s, there are the other people you are around that you might pass this to. And I saw some of these photos from some gatherings downtown in certain commercial locations that did give me pause. So I just want to encourage the businesses that host these individuals, to try to encourage them to wear their masks, be socially distant. But some of the photos were very crowded venues downtown here recently, and not just on New Year's Eve. So I just want to, again, please, everybody, we're all in this together.
I think we all look forward to the day when we can see those crowded areas and everybody's safe, but it's still a while till we reach that point. Any other discussion on 2020-1? If not, the next item is 2020-7, which is the restaurant occupancy limitation and early closure regulation. Comments, thoughts, discussion. I believe this one has got an expiration date that we'll need to act on this evening, if I remember the end date on that one correctly.
Correct. This expires on 1/21/2021 unless we extend it.
So I guess one thing to maybe start a point of discussion is, in our public forum tonight, our first speaker, Mr. Weed, who is I guess a longtime restaurateur or bar owner, had comments about trying to individualize how the curfews are administered, or something along the line of having it somewhat more individualized. And as I was thinking about that as he was talking, I was wondering, how practically something like that might be able to be done, or whether it would be impractical to try and do something like that. And I would welcome thoughts from the board this evening about his presentation and about anything like that might have some usefulness.
I would just put out there that, all of our regulations, they don't vary from restaurant to restaurant. You have to hold food temperatures at everybody has the same food temperature holding for cold food and hot food. Have to follow the same rules and regulations about hand washing for employees. So I would see this as being similar. I think that if we look at the White House report, it continues to talk about limiting indoor dining, and actually talks about bar closures as opposed. I mean, they really recommend that all bars are just closed. And so I think, again, we go back to this as a compromise for our community. Trying to splice it out in different ways is just really even more challenging than the way it is now. It continues to be challenging to enforce, and very variable in its enforcement, and we know that. So I think that trying to splice it differently would be even more challenging for those who are trying to enforce it.
Thoughts, comments, discussion from the board about 2020-7?
I have something. This is up for a vote this evening, and I've been thinking about this one for quite a while. And this evening, I'm really considering voting no. The components of this regulation, I know, are justified by the community data supported by the White House Coronavirus Task Force, like Dr. Buchanan mentioned. That report recommends that we even go further. I'm leaning towards no because I'm concerned that this regulations, the way that it's so specific, might be contributing to some distrust and non-adherence. And it places an unproportional burden on restaurants and bars. I don't believe that we should be reducing safety measures. I would actually like to see increased safety measures, and I'd be willing to discuss that. But I believe that this regulation might not be, I think it leads to confusion, frustration. We know that there are certain situations like bars and restaurants where virus transmission is more likely. But this specific regulation, it leaves out other environments that also have an elevated risk, like gyms, stadiums, movie theaters, And of course, the required exclusions by the state of Tennessee, like religious services. And I'm really apprehensive about voting no. I don't believe we should be reducing safety measures. And I really, really don't like being critical of anything without proposing an alternative. And I'd be happy to discuss that further. I really didn't want to propose a new regulation without having some discussion first. But I just really would like to see something that's a little bit more, I don't know, consistent or easier to follow. But that's kind of where my head is at with this one.
So before I comment, I just want to, Mr. Sanders, are we okay to continue discussion at this level without moving forward with a motion and a second to then open discussion? I think you're on mute.
So, yeah, let me unmute myself here. As far as I understand it, you're still discussing whether or not to renew the regulations. So at this point, you can certainly discuss that. At some point, if you want to make alterations to it, you'll need a motion and a second to make those alterations.
Yeah, if you're good, I'm good. Thank you. So I guess so a thought I have is that, as you know, the data that we just looked at showed just the first signs of maybe some improvement. And I don't honestly know, I alluded that there's a few theories and that I wasn't going to go into them, but I mean, I'll go to them briefly. And I mean, one thing that's being floated around is that snow that we had was the best thing that could have ever happened to us right around Christmas, because people didn't get together as much. And so instead of a big spike, it maybe we're not going to see that. We'll see if that pans out. The other thing, though, is that I do feel that the number of people in our community, if you look at the numbers, who truly have been personally affected by COVID, not just because somebody had it, but because they know someone who was hospitalized or even was aware of someone who died of COVID, that number has increased. And we always said that was going to be part of what has led to some degree of the community and you know how the community reacts to that and their behavior. And so, for example, I guess to your point, Ms. Roma, I would not be of the mind today that we needed to increase any sort of regulation, because I kind of want to see where that heads. But on the other hand, and knowing what the White House report said, I'd like to see a little more of what we just started from a trending standpoint before I would be ready to pull anything back. And so I guess part of the conversation is just where are we right now? And that I don't know that I feel comfortable with the data enough to say I'm ready to pull anything back, but I'm also not feeling like we would need to pass anything broader or more comprehensive. That's just my 2 cents.
Yeah, and I guess just I kind of have the same feeling as that, you know, I don't want to put anything else in, but I'm also a little bit nervous about taking this away, particularly with UT students returning. They're going to be starting classes, I believe, next Wednesday. And so they're going to be rolling back into town. And I guess that just worries me a little bit if you look at what happened back in September when we had the influx of students come back in and when we saw that first spike this fall.
To remind
I'll bring up is just the fact that we may want to compare what we have on our books with the Tennessee Pledge, and to see, since that's our kind of our foundation for the state, and if we got rid of this, we would fall into just the Tennessee Pledge by itself. So there may not be much difference, and I'm a little reticent today maybe to step back, but I think we're getting close to a point where we, like the rest of the state, might be able to use the Tennessee Pledge as our, what we're going forward with here, which we said we would follow, but this regulation is on top of that. So just food for thought.
So to remind the board, we're in a period of general discussion, and we will need a motion and a second to either reapprove this, not approve it, alter it, et cetera. So I'm perfectly fine as chair to continue as general discussion, or if somebody would like to move ahead with a motion, that would be okay as well, because we will have discussion after a motion in a second.
So just one more, at least one more point of general discussion. So I mentioned normalization bias during the data. This is the precise time where we have to be careful about that, is that, you know, the numbers we're looking at, think about what decision we might have made at these similar numbers before, and then our logic and our thought process now. That's a trap that we have to just be careful we don't fall into.
Going back further in the brief history of this, Dr. Shamiya, if you looked at our positivity rates and you looked at our degree of hospitalization in August, and made decisions based on that one period of time, that would have certainly been a mistake, because it was right before things really took off, if they hadn't already taken off by that time. So we're getting a better long view, I think, now, but still, you know, the future is unwritten, especially with vaccines. We may tend down even more than we already are if the vaccinations can penetrate the population better. Other discussion? So we have a decision.
So I'll make a motion that we extend this regulation as it is for 2 more weeks, so, because it expires on the 21st, so until 4/4/2020 at 12:01 or 11:59 or 2/4, not 4/4, 2/4, not 2/4. Sorry, I wrote the wrong month down. I think it expires at 11:59 or 12:01, or I don't have it in front of me at the moment. I thought I printed that page. So I can look it up too. So I'll make a motion, we extend it to 4/4/2021.
We have a motion. Is there a second?
I second it.
So we have a motion and a second. Further discussion on extending 2020-7. Any other thoughts, points of discussion from the board? If not, since we're ready to vote, Charity, if you would run the roll call for us. And again, any other discussion on this before our roll call vote?
We're pulling at the specifics so we can get the wording right for the motion. I apologize, I really thought I had them with you.
Just 1 second. What's the number?
7. 2020-7.
Catherine, this is Charity Menifee, Knox County Health Department. Can you, what's the exact timing in there? Is it 11:59 or 12:01?
I am pulling it up as well. It is 12:01.
Okay, so I would say 12/01/24/2021.
Dr. Goetcher, are we good to do the roll call now with that?
If everybody has finished their discussion points, we are ready for a roll call vote.
All righty. This is Charity Menifee with Knox County Health Department with a roll call vote for the renewal of 2020-7 for 2/4/2021 at 12:01 a.m. Dr. Drake.
Yes.
Dr. Hurt.
Yes.
Dr. Goetcher.
Yes.
Mayor Jacobs.
No.
Dr. O'Brien.
Yes.
Ms. Roma.
No.
Dr. Shamiya.
Yes.
Dr. Souza,
Yes.
Ms. Wagner,
Yes.
Dr. Buchanan.
Yes.
It passes with a vote of 8-2.
Thank you. Next on our discussion is Resolution 2020-8, which is the social gathering limitation regulation. Any opening discussion or general discussion on 2020-8? And I believe this also has an expiration date, if I recall correctly.
I would make a motion to approve for the same, I guess, additional 2 weeks. These two seem to be paired together, in my opinion.
We have
Second that motion.
We have a motion and a second. Further discussion on 2020-8. Dr. Buchanan, have you had any feedback from the public regarding 2020-8?
Not lately that I'm aware of, no.
I'm not aware of any.
Mayor Jacobs, have you had any feedback on 2020-8?
No, not that I'm aware of either, actually.
Okay. Any other discussion on 2020-8? Comments? Hearing none, since we're ready to vote, any other comments? If there are no other comments, we'll move ahead with a roll call vote. Charity, if you could assist us with that, please.
Yes, sir. This is Charity Menifee with Knox County Health Department, voting on the renewal of 2020-8 to be renewed until 2/4/2021 at 12:01 a.m. Dr. Drake,
Yes.
Dr. Hurt,
Yes.
Dr. Gocher,
Yes.
Mayor Jacobs.
No,
I didn't hear what he said.
Sorry, we didn't hear you, Mayor Jacobs.
sorry about that. No.
Dr. O'Brien,
Yes.
Ms. Roma,
Yes.
Dr. Shamia,
Yes.
Dr. Souza,
Yes.
Ms. Wagner,
Yes.
Dr. Buchanan.
Yes.
And it passes with a vote of 9-1.
Thank you, Ms. Menifee. Next item on our agenda is other business. And so this is a point for a discussion of the point that Mr. Hill brought up in public forum, or anything else that we need to discuss in general other business. So
Can we put up with Mr. Sanders as prepared as a possible draft?
that sounds great.
Is somebody over at the health department going to do that, or do you need me to do it from my screen?
We don't have it, so you'll have to do it.
I said it
Oh,
to
wait. Sorry, Kathy has it. I didn't know that.
I do want to note that I sent a revised version with just a few errors corrected about a few minutes ago. I'm not certain whether this is that version or not, because we haven't gotten far enough down to see the changes yet. If this is the one that was sent about 6 o'clock, it is. If it's the one sent about 5:30, there's a newer version.
David, this is Catherine Killen with the Health Department. This should be the newest version, of course. However, if we get down to that portion and it is not, we can certainly fix that.
Great, thanks.
Mr. Sanders, in your second whereas, I only see one little thing there. You may want to put after Knox, the second Knox County, Tennessee, put in have striven. Thank you.
Have striven. Yes, I see it. I also see in the whereas regarding the Constitution, that should be constitutions plural.
The next paragraph, do we need to take out the, like it says, other, the various governing?
Yes, I agree with that. I'm sorry, I did this one on the fly in a few minutes while you all were talking, and I didn't catch all the, as I was editing and revising, I didn't catch everything. I just tried to give you something to start with. This is obviously your document, not mine. So do whatever you want with it.
I think so far the whereases look good.
Mhm. I think as a general comment, certainly with the perceived safety of being on the internet, some people sort of just get into I guess a fever dream or something. They decide that they talk a good game but don't act it out. But remember that there are people who are unstable that might read that and say, yes, I think that's a great idea. So it's not always the person writing the note, but maybe somebody out there that reads it and agrees with it and wants to act on it, that makes this particularly dangerous for any of us at risk.
Mr. Sanders, you've done a great job.
Well, I stole it, as you can imagine, from another bodies, but I adapted it to your use. Fortunately, there are a lot of these. Fortunately for my sake, but unfortunately for societies, there are a lot of these out there right now.
Yeah.
I will move that we accept the amended version of this for consideration for passage.
A second.
We have a second.
Second.
We have a motion and a second on Resolution 2020-E, condemning threats or use of violence. Open for discussion.
I just have this is James Shamia. I just have a question. I mean, that while I absolutely support this, if it hadn't been mentioned in the discussion or the public forum, it's not something I would have thought of for us to do. And I just want to make sure that not knowing knowing the environment that we're all in, is there any potential for an unintended consequence of a document like this?
So my take on Mr. Hill's talk was that these threats were directed by who knows whom against members of the Knox County Commission. Now, I do not know if all members receive these threats or if some members, maybe depending on how they voted, receive those threats. But I think his perception was that the Board of Health might be considered as an instigator in those, which obviously we weren't. And that was the reason that he felt that a statement from our board would leave no doubt that we had nothing to do with that. Now, my perception, and again, it might be wrong, is that all members of the Knox County, the Knox County group, receive these threats. I may be wrong on that, but I thought everybody received them. It's just, kind of a generalized threat to them, in even thinking about either closing the health department down or continuing with it. I'm unclear as to, which side was being advocated by these threats. And if anybody has any more information on that, it might be useful for discussion. But my understanding was Mr. Hill wanted us to make absolutely certain that we put out a strong statement regarding this.
Yeah, I understand. And I think that the statement is very broad and appropriate. I think my question is if someone was moved to do it, could this be inflammatory to the right audience and actually exacerbate an issue as opposed to improve it or help?
It sure could, but these are people who lack rational behavior. So I don't know that anything we do or do not do would affect them.
Yeah, this is Maria. I would say, there's the potential, I'm sure, for someone to weaponize our good intentions, as there often is. But I would rather personally and professionally, and us as a group, err on the side of being very clear. We don't condone, support, encourage verbal or physical violence or threat of violence or harm in any way on anyone, and especially not on our behalf. I'd rather err on the side of caution.
And I know this came up because it was in the paper about the Knox County Commission. And as I stated earlier, it's obvious to us, because it's happened to us, threats have come our way. And so that has not made the paper. Didn't need to, because we wanted to deal with it. But now that this is out, we want to basically say to everybody in the community, and public health is that we need to be safe. We need to do our jobs. We're here for you. And that we're all in this again together, both us and the county commission. And we ask people to stand down who might decide to take the law into their own hands.
Other points of discussion, concerns? Any additions or corrections or substitutions that we needed to look at regarding 2020-E? To me, it looks acceptable. Is it acceptable to everyone as it reads before we decide to vote on it?
Is this, never mind. No, does it matter? I need help with procedure here, because we have resolution 2020C that was previously D, but became C during that meeting. And so is the proper letter now for this one to be E, even though we have never actually enacted a D?
Mr. Sanders to the rescue. Help us with
I
that.
would say that's correct. I did take the heading off of the proposed resolution D, forgetting that it was never enacted, and I just advanced it one letter. So yes, if you've never enacted resolution D, then it should be whatever the sequential letter is. It's a good catch. I forgot about that.
Thank you, Mr. Roma. Good catch. So we're going to consider it as 2020-D, is that correct?
Sounds good to me.
So a minor change in the document itself to reflect 2020-D is the one we're going to be considering. And just a minor thing. So I think the motion and the second still stand. We're in a point of discussing and ready to vote. Maybe more discussions on it. If not, since we're ready to vote, Ms. Menifee, would you conduct a roll call for us on 2020-D, please?
Yes, sir. This is Charity Menifee from Knox County Health Department with roll call for resolution 2020-D. Dr. Drake?
Yes.
Dr. Hurt?
Yes.
Dr. Gocher?
Yes.
Mayor Jacobs?
Yes.
Dr. O'Brien?
Yes.
Ms. Roma?
Yes.
Dr. Shamia?
Yes.
Dr. Souza?
Yes.
Ms. Wagner?
Yes.
Dr. Buchanan?
Yes.
It passes unanimously.
Thank you, Ms. Menifee. Is there any other item of business under other business to come before our board this evening? Any other announcements, points of discussion? If not, we can entertain a motion to adjourn, but is somebody on the line?
Yeah, Dr. Goetsch, just one more thing, please. again, I'd just like to thank Dr. Buchanan and the health department as well as the hospitals for the Herculean effort that they have undertaken with vaccination. It's really been impressive. So thank you all so much. In addition to everything else that you've done up until this point, the vaccinations, we have a limited supply and demand is overwhelming, and everybody's done their very best to accommodate that as well as they could. So, job well done. Thank you.
Thank you.
Points well taken. Thank you, Mayor Jacobs. Any other points of discussion, concerns, any other items under other business for this evening? If not, we can have a motion and second for adjournment. And our next meeting is on, Dr. Buchanan, do you have the date for the next meeting? Because I don't have a calendar in front of me right now.
27th.
27th of January. Okay.
I move we adjourn.
I second.
Sounds like a plan. Thanks, everybody. Have a good evening and good night.